Hello, everyone, and welcome back to Dr. Paul's Health and Wellness System, the podcast where we answer your pregnancy questions with simple, trusted medical advice you can actually use. Last week, we talked about post-delivery care, the common mistakes many new mothers make after childbirth, what to avoid, and how to recover safely while caring for your newborn. If you missed that episode, I encourage you to watch it after today's discussion because it contains valuable tips for every new and expecting mother. I'm Dr. Paul, and I'm delighted to have you with me today. Now, today's topic is one that almost every pregnant mother wonders about. When should I start feeling my baby kick? Why is my baby moving so much? Should I be worried if I haven't felt any movement today? These are some of the most common questions I hear in the clinic, and it's completely normal to have these concerns. The good news is that your baby's movements are one of the best signs of their well-being. Learning what's normal and knowing when something isn't can give you peace of mind and help you recognize when it's time to seek medical attention. So today, I'll be answering the most frequently asked questions about baby movements in a simple, practical, and easy to understand way. Whether this is your first pregnancy or you've had children before, I believe today's conversation will help you feel more confident, more informed, and more connected to your growing baby. So grab a seat, relax, and let's dive into today's episode, Baby Movements. Let's get started. Most women begin to feel their baby's first movements between 16 and 24 weeks of pregnancy. If it's your first baby, you may notice the kicks a little later because it's harder to recognize those first tiny flutters. Don't worry if your experience is different. Every pregnancy is unique. If you're 24 weeks pregnant or more and you still haven't felt your baby move, please contact your healthcare provider for an assessment. Every baby has their own unique pattern. As your pregnancy progresses, especially in the third trimester, you should feel your baby moving regularly every day. The important thing isn't comparing your baby's movements with someone else's. It's knowing what's normal for your baby. If you notice your baby's usual movement pattern has changed or reduced, don't ignore it. Contact your healthcare provider. An active baby is usually a reassuring sign. Babies naturally kick, stretch, roll, and respond to sounds, your voice, meals, and even changes in your position. So, lots of movement is usually nothing to worry about. What matters most isn't how active your baby is today, but whether there's a sudden change from your baby's normal movement pattern. Sometimes your baby is simply asleep. Babies have sleep cycles and can sleep for up to 40 minutes or even a little longer. However, if your baby is moving much less than usual, it's something you shouldn't ignore. Lie on your left side and pay attention to your baby's movements. If they're still reduced or you're concerned, contact your maternity unit or go to the hospital the same day. Kick counting is a simple way of paying attention to your baby's movements. Many mothers count how long it takes to feel 10 movements. It's not about reaching a magic number, it's about becoming familiar with your baby's normal pattern. If you notice your baby is moving less than usual during kick counting, don't wait. Contact your healthcare provider. Yes, they absolutely can. Baby hiccups often feel like gentle, rhythmic little taps inside your tummy. They're a normal part of your baby's development as the breathing muscles and diaphragm mature. In most cases, baby hiccups are completely normal and nothing to worry about. If you ever have concerns about your baby's movements, speak with your healthcare provider. Many moms notice this. During the day, your walking and daily activities gently rock your baby to sleep. At night, when you're resting and everything is quieter, you're simply more likely to notice those little kicks and rolls. Your baby isn't necessarily becoming more active at night. What's important is that they continue to have their usual movement pattern throughout the day. You may notice your baby moves after you've eaten, including after something sweet. That's because nutrients are reaching your baby, not simply because of sugar itself. But I wouldn't recommend eating sugary foods just to make your baby move. If you're worried because your baby isn't moving as usual, don't rely on sweets or cold drinks. Contact your healthcare provider for proper assessment. Yes, a noticeable decrease in your baby's usual movements should always be taken seriously. In many cases, everything is perfectly fine, but sometimes reduced movement can be an early sign that your baby needs medical attention. Never wait until the next day if you're concerned. Contact your maternity unit or healthcare provider as soon as you notice reduced movements. If your baby is moving much less than usual, stops moving, or you simply feel something isn't right, don't wait. Go to the hospital immediately. I'd always rather check a healthy baby than have a mother stay home worrying. Trust your instincts. If you're concerned about your baby's movements at any stage of pregnancy, seek medical care the same day. Early assessment can make all the difference. Remember, every pregnancy is unique, and your baby's normal movement pattern is one of the best ways to know they're doing well. If you found this episode helpful, please like, share, and subscribe so you don't miss our weekly pregnancy and maternal health discussions. And if you have a pregnancy question you'd like me to answer in a future episode, leave it in the comments below. I just might feature your question next. Until next time, I'm Dr. Paul. Take good care of yourself, take good care of your baby, and remember, a healthy mother is the first gift to a healthy child. God bless you, and I'll see you in the next episode.